A brain aneurysm is a weak spot in the blood vessel in your brain that bulges or balloons out, kind of like a bubble on a tire. This bubble forms because the wall of the blood vessel becomes thinner or weaker in that area. And just like a bubble, if it gets too big or too much pressure builds up, it can burst. If that happens, it causes bleeding in the brain, called subcarotid hemorrhage. This is a type of stroke, and it's life-threatening. Why do aneurysms form? Aneurysms usually form when blood vessels in the brain branch or split because those areas are under more pressure. Some people are born with weak spots in their blood vessels, while others develop them over time due to factors like high blood pressure, smoking, alcohol or drug use, family history, or certain conditions like kidney disease. Most aneurysms develop quietly, without symptoms, and people may not even know they have one. In fact, many are found by accident when someone gets a brain scan from something else. When an aneurysm ruptures, blood leaks into the space around the brain. This puts sudden pressure on the brain tissue, cuts off oxygen, and can cause brain cells to die within minutes. It's a medical emergency. Signs of a ruptured aneurysm include a sudden, extremely painful headache, nausea or vomiting, stiff neck, blurred or double vision, sensitivity to light, seizure, loss of consciousness, and trouble speaking or confusion. If you ever notice these symptoms in yourself or someone else, call 911 immediately. Fast treatment can be the difference between life and death. How are brain aneurysms treated? If an aneurysm hasn't bursted, doctors may monitor it with brain scans. But if it's too large or risky, they may treat it with using these two methods. Clipping. A surgeon places a small metal clip at the base of the aneurysm to stop blood from entering it. Or coiling. A thin tube is guided into the aneurysm and tiny coils are placed inside to help it clot and seal off. These procedures can prevent a rupture from ever happening. Can you lower your risk? Yes, you can protect your blood vessels by controlling your blood pressure, not smoking, managing stress, and exercising and eating a healthy diet. So final thoughts are, a brain aneurysm might sound scary, and it can be, but knowing the warning signs and taking care of your blood vessels makes a big difference. It's not just about reacting to symptoms, it's about understanding your body and protecting your brain before something serious happens.